off our discussion tonight, Ron Klain, former senior aide to President Obama and Vice President Biden. He served as the Ebola czar during the Obama administration. And Dr. Rob Davidson is with us. He's an emergency medicine physician. He is the director of the Committee to Protect Medicare. Dr. Davidson joins us from Michigan. Ron Klain, I want to start with what we just heard about Donald Trump trying to get people back into churches, but he's saying that he's telling the CDC what to say about churches, and he's telling the CDC, you better get it out.
Yeah, I mean, the Center for Disease Control, before this began, was the world's most esteemed public health agency. People from around the world sought the CDC's advice and guidance on how to handle epidemics in their country. Of course, Americans have always sought out how to handle epidemics and infectious disease outbreaks and other public health challenges in our country. And now what the president has said is that he's going to corrupt that institution, just like he's corrupted every other. Today's statement by the president was more obvious, Lawrence, but it wasn't the first. We know that this current situation began back in February when Dr. Nancy Messonnier, the senior person at CDC in charge of respiratory diseases, spoke publicly about how the country was going to be disrupted by this virus. And the president called and said she should be fired and silenced. And we've heard very little from her and the CDC in public ever since. And so the president has tried to silence the CDC. He's tried to corrupt the CDC. What he's tried all along is not to let science guide the response, and we're all paying the price for that.
Dr. Davidson, Donald Trump said today that the reason he doesn't have to wear a mask, even though he was wearing a mask some of the time he was at that Ford plant, but the reason he justifies for not wearing a mask is that he gets tested a lot. And so what he's saying is, if you get tested a lot, you don't have to take the same precautions than people who do not get tested.
Well, he may be at lower risk than other people, although he's in contact with a lot of individuals. And the tests that they're using at the White House, the rapid test that uses a dry method, study out of NYU just last week said that there may be up to 48% false negatives. So the president may be harboring the virus and he just doesn't know it. But more important than that is that he has the attention of millions of Americans, both people who support him ardently no matter what he does, and others who are just casual passersby who happen to look up at a TV screen. And when they see the leader of the country not wearing a mask, it gives them license to say, well, I don't have to wear a mask. So when I go to the grocery store or the pharmacy, I don't have to protect my fellow citizens because the president doesn't have to do that. It's about leadership and speaking with one voice, and he's failing us yet again in that.
All right, control room, let's get the picture of him with the mask on up again. Since he hasn't been wearing masks, it's good for America to see this example. And Ron Klain, as we look at the mask, we should include the fact that the Ford company told the president's team that you are required to wear masks there. They said they, of course, wouldn't force the president to wear a mask. But at least, and I guess we'll call this progress in Trump world, at least the president, as we see in that picture, complied with Ford's policy while he was actually meeting with the Ford people and discussing what was happening there at the plant. So there's that. Let's listen to what the governor of Michigan just told Rachel Maddow about this.
All of the Ford executives wore the mask. All of the employees were wearing masks. All of the press were. And it's really important that anyone with a platform has a responsibility to make sure that they model precisely what we're asking everyone else to do. This is about public health, not one person's or another. This is about all of us. And anyone in a position of power and responsibility, I hope, emulates and does precisely what they're asking everyone else to do.
So, Ron, there's a piece of progress there in that the president did at least wear a mask. But this really was a campaign trip. This was non-essential travel to that Ford plant.
Well, there's a piece of progress, Lawrence, but of course it's ironic because what the president said was, I didn't intend to have you see me in a mask. I intended to not have you see me in a mask. I thought I was hiding it, which is, of course, as Governor Whitmer suggested, exactly backwards. I mean, look, you began the program by citing the fact that 36,000 Americans died because the president froze and didn't act quickly on shutting things down. Now, the question now is how many Americans will die now because the president continues to flaunt the idea that we should be wearing masks, not to protect ourselves, but to protect others. This is a public health matter, just like drunk driving is a public health matter. We shouldn't drive drunk because, of course, it makes us safer, but more importantly, because it makes other people on the road safer. We should wear masks for the same reason, to protect others. And when the president basically makes fun of this requirement, makes fun of this, he's really telling people it's not important. And a lot of the death toll will continue to mount as a result.
Dr. Davidson, you joined us on many nights when it seemed Michigan was being overwhelmed. What is the situation in Michigan today? What's happened to the curve there? What is happening? How much caution still remains among the people of Michigan? We know there are some protesters, but what's the general level of caution there?
I think we're being extremely cautious, but you played a clip of our governor, and we're extremely proud of her leadership. She has modeled exemplary leadership in this crisis. The only reason that we are able to start coming out of the shutdown, she announced some relaxing of that today. But still in West Michigan, where I practice, some cases are starting to creep up a little bit. And we've talked about hydroxychloroquine this week with the president. We've talked about masks, but his greatest failure still to date is the lack of adequate testing so we can test, trace, and isolate and truly safely open this economy and get Americans back to work for a lasting way. And the more we don't talk about that, I'd say is a pretty good day in the news cycle for Donald Trump. So we just need to keep pressing him. We're getting about a third of the tests we need every day in this country. We need the president to use the Defense Production Act and get us the tests so we can do the job we need to do.
Dr. Rob Davidson, thank you very much for bringing us back to where we should be on this subject. Really appreciate it. Ron Klain, thank you for helping start us off tonight. Appreciate that.